So now with our background that we've established on strabismus, let's think about what history questions should be asked to a patient. So why don't you take a moment as a student just to think about what questions you would ask someone where you suspected that they were experiencing diplopia. So here are probably some very basic questions that should be asked to everyone. And so the first two are always asked together, and those are, does your vision improve when you cover your right eye? And does your vision improve when you cover your left eye? Because if their blurry or double vision is occurring because of a misalignment between the eyes, then it should always be better when they look through either eye alone. And it's important to point out here that both of these questions need to be asked so that you're not fooled by a case of a monocular diplopia. For example, let's pretend that the patient has diplopia because they have a monocular diplopia in their right eye from some sort of corneal opacity, for example, or astigmatism, and you just ask them, does your vision improve when you cover your right eye? Well, the patient will say yes, and then you'll be fooled to thinking that they have a strabismus, when again it's just because they cover the eye where they're having their monocular diplopia and their vision improves. So you need to establish that in either eye the vision improves when either eye is occluded. Then the next question to ask is, what direction is the diplopia? Is it horizontal? Is it vertical? Is it diagonal? And of course this would give us clues, for example, of whether we should be thinking about something like a 6th nerve palsy or a 4th nerve palsy. Does it change when you look to the sides, when you look up or down, or where you tilt your head to the side? Again, these are clues that would, same sort of answer, give us clues as to whether we're dealing with a 6th nerve palsy or a 4th nerve palsy, or etc. So do your eyelids droop? As we've learned, eyelids can droop when you have, probably the two most important examples would be myasthenia gravis or a 3rd nerve palsy. Is there variability during the day, which would happen in myasthenia gravis, where often the patient wakes up and they feel fine after a good night's sleep, and then it's only during the course of the day as they become fatigued where they develop their symptoms, including the diplopia and the drooping of the eyelid. Has the appearance of your eyes changed? So this would be relevant to thyroid ophthalmopathy, where sometimes someone comes in for the first time, and to us, maybe we don't really notice that their eyes are have a little bit of a proptosis. But if you ask the patient, maybe they're also a little bit red, a little bit hyperemic. But if you ask the patient, they'll say, oh yes, my eyes, if you looked at them 2 years ago, they look more, a lot less bulging out and a lot quieter. And of course, are there any other symptoms that you're experiencing beyond the development of the eye findings? Sometimes in certain neurological syndromes, the diplopia could be associated with, for example, the development of arm or leg weakness, and that could point us in various directions as to where specifically the lesion is occurring.